I'm like halfway through and realise either I haven't formatted the SD card or none of this is on record.
God.
But yeah, no, we're live now.
Oh, shit.
Sana, how are we?
Oh, very well. Long drive, but
Long
worth
drive.
it.
Caught in the traffic.
Jubilee.
I know.
I didn't know everyone was out celebrating the Queen's, coronation?
Street parties on the M25.
Yeah. Beautiful party.
Nice. If you just, into this camera here, give us a little explanation of who you are and what you do.
Okay, so my name's Sana Sadiq. I am a few things. So I am a dentist, largely cosmetics, and I'm also more and more so a cosmetic doctor, specialising in non-surgical facial enhancements. But my background is not actually dental at all. It was chemistry. Yeah.
Chemistry?
So, yeah.
I don't want you to be offended by this next question.
Go for it.
Are you a real doctor?
No, I can't do like heart surgery.
Well, what counts as like a real doctor?
Well,
is it?
This is a very contentious topic in a dental
I'm sure
community because like dentists use the term doctor, right? And sometimes I feel a bit weird when like my patient goes, doctor, blah, blah. And I'm like, wait, that's not me. That's not me. But some people say it's an honorary title, but like all my bank stuff says doctor.
Oh, does it?
Yeah, passport says doctor and stuff like that. I worry sometimes if there's ever an emergency.
Yeah, they might think you'll be able to fix everything.
Shit. No, I can do CPR. I can do decent CPR and that's about it. But no, I'm not a doctor, not a medical doctor. I'm a dental doctor.
Is it the same as getting a doctorate at uni? Is that what it is?
No, you see that. But then PhD people have gripes with doctors, medical and dental, because they're like, you're not a doctor if you don't have a doctorate. You've never done a dissertation. You haven't done a thesis. So,
I know so many people that have done dissertations that aren't doctors. So that's just,
exactly, yeah. But and I'm like, well, I've done my master's in quantum chemistry. Am I more a doctor now? No, I don't know. But dentistry people are very protective of the term doctor. They really do like to keep it. Like they all get like custom license plates that say like Dr. Tooth and stuff. So,
I'll remember that next time I see my dentist.
There's a lot of them.
You've got an interesting story on how you got into this, because it's, when you told me it in person, it was like a shock at every turn, really, because like I couldn't really like. It's like, well, how does that lead into that? And how does that lead into that? Give us the rundown from little Sana up to Dr. Sana.
Little Sana wanted to be an artist. I wanted to do fine art. My mum's family are all artists, basically, and my dad's side of the family were all like judges, lawyers, and like engineers. I love maths, love maths, but love art more, and there was more of a scene with art than with math. So I really wanted to go to art school. Had loads of fights with my harsh Pakistani parents, and in the end they didn't let me. And when they came round to it, it was too late. I completely messed up all my A-levels and stuff. I was just so distracted. I just wanted to go out, and somehow randomly managed to get into Queen Mary for chemistry with biochemistry.
See, that was the first thing that I thought was so weird, because you said you fucked everything up, or you felt like you did, and then you just got a course doing chemistry at uni.
Random. So I was actually at a private college in London, having a tour to redo my A-levels. I was going to redo my A-levels and then try for something else. But literally, as I was about to get on the tube and lose signal, I got a phone call like, you have 1 hour to accept this. And I was like, oh fuck. I'm like, I'm going to uni. I am leaving home. There is no way I'm staying home another year. So I ran home and accepted it. And then I did 3 years of chemistry with biochemistry at Queen Mary, and realised I actually really like physics, because a lot of it was actually quantum and atomistic physics, and ended up doing my master's in quantum chemistry, researching materials. And then that is when I got interested in dentistry, because the material I was studying was a dental material and a biomaterial, and I was working with a lot of dentists. And I'm not going to say the science scene isn't lit, because it was actually quite fun, and you get to travel a lot, and scientists are actually low-key really fun people, like wild weird parties on like I remember like when I was on my master's, I was randomly presenting at some place in Slovenia on like the top of a mountain. We were staying in a castle on the top of a mountain. Some weird sordid stuff was happening that night.
Sounds like
honestly.
some Illuminati shit.
It was honestly like I don't know what was going on there, but I don't think I would have ever gotten into stuff like that doing dentistry. But I was meeting a lot of dentists along the way, and they seemed to have a really like fun life. And then I went and shadowed some, and I was like, they just chat basically, and they made it look so easy. Now in hindsight, I'm like, oh, maybe they were a bit negligent, and maybe they weren't doing the best dentistry. But it suited me more, and so I ended up applying on a whim, and I got into King's on an accelerated version of dentistry where I got to skip the first year. Then I became a dentist, and then you have to do like a 1-year junior doctor kind of thing. And during that, I learnt. So like 8-9 years later, I learnt that you can actually do all this non-surgical facial enhancement stuff, which I found was my strength. So yeah, so it's kind of like all the artistry stuff that I always wanted to do, and all the sciencey, mathsy bit as well. So yeah, it's been a weird, long journey. I could not have designed where I've ended up at all.
No,
I don't know how I ended up here. It's ridiculous.
And you're having fun doing it?
Yeah, I am. I love it.
It's the main thing.
It's the thing I like most out of everything I've ever tried. So yeah.
When we are in the clinic, some of the conversations we have about some of the people that are allowed to do the sort of stuff you do, as in like the non-surgical adjustments to the face, that sort of thing. What you obviously you got a dentistry background.
Yeah.
What other backgrounds would someone need to have if they wanted to get into that?
Literally nothing.
You can literally have no background, nothing, and you can
do anything, which is quite terrifying. Yeah, it's weird. I think we're like one of the only countries that has this. But in this country, fillers are a medical device. They are not a medication or a drug. So that means that anyone can administer them. Like Tracy from Tesco can.
Even if your body can have a reaction to whatever's
doesn't
it's
matter.
Still not. It's just seen as an instrument.
Yeah. Exactly. So anyone can do it, but there are new stipulations and things being brought in, and the law is slowly moving to outlaw the use of it in non-medically trained people.
Sure.
So really, it should be anyone who is registered with like the Nursing Council, the Pharmacy Council, the Dentistry Council, and the Medical Council. So GMC, GDC, NMC, and GPHC. They are the ones. And
so someone that doesn't come from a medical background like yourself, can they apply to those individual bodies for...
You have to have the degree.
You have to have
done the degree relevant. So you have to have done the pharmacy degree. You have to have done the nursing degree. You can be a midwife. But, yeah, you can't get registration without going through the whole exam and all of that, yeah.
See, when you say you can be a midwife, I don't really know what a midwife's job entails, obviously, apart from delivering babies.
But it seems...
What is there just like basic characteristics of a background you need to have that then qualifies you for that? So for instance, if you're, in my own mind, I'm thinking if you're a midwife, then you have to have, these are all just assumptions. Are you like, you know how to use a needle or something? Like, you know, is that,
well, some elements
administer
of
things?
that.
Is that what it is?
Some element of that for sure. But because these jobs are not just jobs, they're seen as duties. So there's a whole other... Basically, being registered with these bodies means you have to adhere to certain principles.
Sure.
So, like the GDC, General Dental Council, has like a number of principles, and you have to live not just your professional life, but your whole life by it. So it brings into call professionalism, ethics, governance, protection of data, what you would do in difficult clinical situations. Like you're trained as to like what to do if you suspect like child abuse, things like that. So
it encompasses a lot of ethics.
A lot of ethics and knowing protocols for things. And yes, you have to learn a lot of fundamental biology, biochemistry, understanding of human disease. So even a midwife, she basically has done nursing. So it's almost like a branch of nursing.
Sure, okay.
So they have learned a great deal about human body and how everything works, how it's connected, anatomy. But even just having these qualifications, like I think even if you're a doctor, a dentist, that alone does not make you safe to inject a person's face. There's no way I would be safe to inject someone's face without all the further training I've done since. So it's just constant further training.
It almost seemed like, and I don't know whether this sort of background you'll be more in tune to, but when I started seeing all these sort of like duck lips coming about I don't know, like 5-6 years ago or whatever.
Yeah.
Is that the sort of same time that people realise they can make a load of money of this just starting up and putting this in people's faces? Or
I actually think it's been going on longer. I think it's been going on longer. Yeah. So much longer. Even a lot of that duck lip stuff does also come from professionals.
Right.
It is a matter of
I suppose
skill
it's what the client
and
wants
taste
as well.
And and some practitioners, and as long as they're being safe, I think everyone does have the right to look how they want. So if someone likes a fake look, and if someone likes their lips disproportionately big, as long as the practitioner doing it is doing it stepwise, safely, with the adequate materials and technique, your face, do what you want, as long as you're screening that person for body dysmorphia and self-esteem issues and stuff, because that is a huge part of this. Like, I say no to so many people, and just because someone wants big lips doesn't mean that they have body dysmorphia or something. It's much bigger than that. So as long as it's being safely done, I don't mind. But I think that duck lip thing has been around for a while. I think it's also to do with what the materials used to be like. Materials have really come on a long way. They used to use like this silicone permanent type fillers, which there is literally no way to get rid of them except surgery. So once it's in your face, it's there. Your mouth particularly is a part of the body that's moving loads. It's not bolstered to bones. It's just a dynamic muscly area. I'm using it so much right now. You're moving that filler around and it's going to spread somewhere eventually. So then you see like that crazy look where it almost looks like a monkey. Like,
is it like the lip forms above the actual lip?
Yeah, exactly. Yeah. So there's what we call the red lip and the white lip.
Yeah.
And it's a spread from the red to the white.
Yeah, sure.
And it's just, it can happen with any filler, but it's much more likely if you're using too much, which is why if you want big fat lips, you've got to be slow. It doesn't happen overnight.
Okay.
So it's everything. Everything. You've got to be cautious and take careful steps.
Sure. Is there a database where I can have a look at said person's procedure and then have a look who's done that?
No. Nothing.
In my mind, there should be something like that in place. Is that just too difficult to enforce?
I think it would be difficult, but like it's difficult enough. Like even like things which are really essential, like dental records, they're not centralised.
Right.
So like I think it would be really difficult to do that unless they started getting all aesthetic practitioners onto some certain register where you have to upload all your stuff. I can't see it happening though because they don't even care for like essential health things like dentistry.
Sure.
So
yeah, because in my mind,
who's going to govern it?
It's like when you do a check on a company before you work with them on Company's House or something. Like,
yeah.
Like I don't want to pick holes in this person, but
okay.
A key like botched figure in my face was like Molly May with all her fillers in.
Oh, poor Molly May.
And I've only seen her face because my missus always sends me stuff from her because she's obsessed with her. And I didn't realise how like what her filler looked like before because I just had this image in my head of her, and she sent a picture to me the other day, and I was like, that is crazy. It looks like one of those you know those old toys that was filled with like cornstarch that you drop and then it just goes.
Oh,
that's just what it reminded me of because it was just like a dinner plate.
It is. Okay, I think Molly May recognised that her filler wasn't optimal.
Yeah, she did.
She dissolved it and then she got it redone in a natural way. She looks great now. And to be honest, there will be people who are happy with the way Molly May looked when she looked like, in your opinion, a cornstarch.
That's understandable.
Doll. But
probably a strong opinion.
I guess the problem is like when you have lots of friends who have similar work done by a similar person, it's often like one person who's responsible for a certain look in an area. You kind of all lose concept of what looks normal.
Yeah.
And I think that about celebrities and stuff as well. Like everyone's talking about like Madonna has this crazy puffed up face right now and like these lips and it's freaking...
It's just like she had a stroke.
I don't know, bless her. Like I know like she made her business on being like really sensational and like provocative and like, oh, I'm gonna wear a crucifix and pretend to bang Jesus, but I'm wearing a tiny whatever. But you can't, well, you can do that into your 70s and stuff, and she is, but it's just, at some point you have to reconcile with aging.
That's
like,
understandable, actually.
We're not, just because I'm in like rejuvenation stuff doesn't mean I think that I'm going to be able to look in my 20s forever.
Yeah, sure.
I just want to soften the blow. It's so sad.
Being in this sort of like job where people tend to come in and they want to look a bit younger, is that the general conception you get, or they don't like a certain part of their face, they want to change the shape of it?
Both. So I like call it's basically adjusting disproportions and addressing rejuvenation. So it's like, dealing with aging and looking tired, but also like, oh, I don't like this kink in my nose. Oh, I don't like my chin. It's really far back. Things like that.
Okay. Have you ever looked into sort of like the anti-aging side of things that is done on like a molecular level to your cells, that sort of stuff?
Well, there is all of that kind of stuff. Like we were discussing it before. Me and my husband Robin, we talk a lot about this because there's all these like longevity. Longevity's a big thing, right? And what's the word for it? It's not restorative medicine. It's like there's a word for it. It'll come back to me. regenerative medicine. That's it. And that's a really big thing on like forums, isn't it? Like Reddit and all of these things. Regenerative medicine's the big thing. I mean, all this biohacking and stuff as well. I am into all of this stuff. I do like reading about it. Am I going to go and try some crazy experimental thing on myself? No.
Okay.
I like evidence-based. I like things that are tested safely.
Sure.
But in terms of from a diet and things perspective, yeah, I'm interested in like what affects my hormones, what affects my mineral and vitamin levels, etc. So yeah, aging's not just going to happen from the outside, it's happening from the inside. So yeah, I think you need to, if you really care about anti-aging as a whole, you can't just be like doing stuff to the outside of your face.
Would you, if there was a pill tomorrow that you could take that could keep you the age you are now, would you take it forever?
Yes.
You would?
Yeah, why not?
I could give a reason why not.
Why not?
Because you're like, death is not inevitable anymore.
Yeah, that's really interesting paradigm shift, isn't it?
If death isn't inevitable, then what motivation would a lot of people have to try and live in the moment?
Well, I don't know, but that's quite small in a way. Like, I don't want to think about just like my life on a day-to-day basis. If I knew I wasn't going to die, and you have really good ideas, you can actually sculpt the way the world changes. I don't know. Eventually, well, surely you could still die. Someone can kill you.
So you can stop
You won't
taking the
naturally
pill as
die.
well, can
Yeah.
you? Yeah.
So when your mission is accomplished,
Yeah, sure.
you could flush it down the loo.
Sure. But then, in turn, the wrong people can get hold of that. And
Well,
then,
this is the thing, isn't it? This is the thing. So if it exists, maybe it exists.
Maybe it
Who
exists
knows?
already,
Maybe
yeah.
it exists. Usually, what's it? Someone said, if you can think of it, it exists.
Yeah.
That's with every technology and all of these things. They won't publicise it, will they? They're not going to make it for sale for any old mug.
No,
Can you
that's true.
imagine?
Yeah, Donald Trump just telling everyone to go. Well, it's like when he said about drinking disinfectant,
I just don't
and people
know.
start actually doing it. So it's just if everyone starts doing it, then the power sort of goes away from it. I don't know.
There are so many mad people in the world. There are so many silly people in the world, and there are a lot of rich, silly, rich mad people too. So
the thing with that Donald Trump statement though, and
I don't know if it was actually a statement though.
I think he said it. I can't remember what sort of addressing it was, but he was in front of a podium with reporters there.
Yeah, I remember. He was like, if there's some kind of, I don't know, disinfectant, if there's some kind of like antibacterial, if you could put it in your body.
Yeah, I'm not sure. Have you heard of? Again, I can't remember the name of it, but there was a treatment that was being tested where to fight COVID, where it was like a disinfectant sort of like mouthwash.
Okay.
Because again, this is just what I've heard. I've not actually dug into the research, but I think I saw it on Joe Rogan. He had someone on talk about it.
Okay.
Saying that a lot of the actual like COVID itself gets stuck in the back of your nasal passages and the back of your throat. And they said people that were using this mouthwash daily in the area that it was being used, the actual rate of COVID dropped because it didn't have the time to reproduce. And they were actually talking about maybe Donald Trump had just been told this and he just relayed it in such a haphazard way.
Like, how would your granddad talk about something?
Yeah, exactly.
Like, I think this is the thing. But, well, in dentistry, when COVID hit, the thing that went out of stock was this mouthwash called Peroxyl, which is a hydrogen peroxide mouthwash.
Okay.
Because we all wanted it because it's proven to kill COVID.
Right, okay.
And where does COVID enter from? Yes, the upper respiratory tract.
Sure.
So that's nose and throat. So everyone wanted their patients to do like a 30-second gargle with it to reduce the viral load if there was anything there. But also, yeah, it's got to enter somewhere.
Sure.
So catch it at the top, basically. But there are other disinfectant type things which technically are consumable. So hypochlorous acid is another one, which is, you see me on clinic often wiping people and I say, oh, I'm sorry, it smells a little bit like a swimming pool. It smells like bleach.
Okay.
But it is actually a consumable disinfectant, which
Right.
you can literally spray in your eye, back of your throat.
Oh, really?
Yeah. And you can eat it, literally. I don't know what the benefit would be to eating it,
sure.
but it's good for disinfecting mucous membranes and things where you can't put like an alcohol gel.
Sure.
So
How did COVID affect your practice? Was it?
Oh my God, it was madness. So we were working and then literally one day they were like, guys, we're not coming back tomorrow. Cool. Like when we don't know how long. So that was like March. I want to say like 21st, 23rd, something like that. Then literally didn't work from March to July. Like dentistry was closed down. They made like all these emergency hubs. Obviously aesthetics we completely stopped anyway. But even like essential dentistry was so limited. They were literally just taking people's teeth out in like these emergency hubs made up. Dentists, what a lot of people don't know is a lot of dentists, most of them who aren't working in a hospital, even if they're NHS, they are self-employed as well.
Okay.
So there was just the SEISS, whatever that scheme was to give people.
Oh, what, the grants?
Yeah, the grants. So that was the only thing that dentists were relying on. It wasn't so bad if you are further into your career, but if you've only done like one tax return, it was a really tough time.
That was something I was going to bring up actually, because I was self-employed. Well, I am now, but at the time I was. And
were you freshly self-employed?
Yeah, I was 2 years.
Oh, I was.
I think the cut-off was 3 years when I looked at it.
I was 1 year.
So you couldn't get access to any of that, could you?
I got 6. Well, basically, my first tax return only has about 6 months, but then they extrapolated that to 12 months. And in the beginning of a dentist's career, you're spending loads of money on extracurricular courses. So I must have what did I get from the SICE? I got like £1,800, I think, or £1,700 to last me up until when we started again. So basically, I was just relying on savings because that didn't even cover my finances to pay off all my courses, because I had so many direct debits for different courses at the time. I was like, crap. And I just bought a new car.
Right.
And I was like, shit, bad timing. I was like, I got a beautiful Mercedes, but I can't do anything with it. Yeah, that was tough. But then I tried to be proactive. I tried to make an online skincare platform. I did make one. At like 3 a.m. in the morning, I had like this brainwave. I'm like, oh, how do you make a website? And I like bought the domain on GoDaddy. I'm like, now how do I design it? I was like really thick about the whole thing. And I'm still the only person like managing it really.
So what's that platform called?
It's called Skin by Science. And it's basically just a way for people to access medical grade skincare remotely.
Oh,
which,
okay.
Is a whole different school of skincare to what you get over the counter.
Sure. See, I didn't even know you did that.
I don't really talk about it.
Do you still have active?
I have orders, but it's just there's like, how many things can one person manage? So that's the thing. So to be honest, I made no money. Actually, I just spent money on it at the beginning, and only in October 2020, actually on my birthday, did I actually get my first order.
Oh, nice.
So yeah, I've been having like some little orders. I literally don't market it. I don't do anything, but just like, I think just through Google, I get these. I went through a period where loads of people from Ireland started buying stuff. I'm like, what's happening in Ireland? Why are they talking about me in Ireland? I don't know. But yeah, I just randomly get orders through there. But medical grade skincare is a little bit of a different bag. Like, you really need consultations. I need to go through your medical history. So it is a long process. So like, on top of like working clinically and then like actually, because I'm still practicing in dentistry and in facial aesthetics, it's a lot. It's a lot, so I don't really market it, and if stuff comes in, it comes in. So
the consultation side, is that just done with the information they provide you, or do you actually have a video consult with them?
So it depends on what kind of medical grade skincare. If it's something prescription, like prescription strength retinols, then it may well need to do a video. But I have like this form that people fill in, and then it's got all their medical stuff, all the concerns, that you have to upload pictures of the area that we're treating. And then a lot of the time people will try and buy stuff that is just not appropriate for them. Right. And then I should cut it off at that point.
You still have the power to cut that?
Yeah, I can do whatever I want. Okay. So until I'm happy that someone's safe to have it, I don't process it.
Sure.
And if they're not, I just refund it.
Okay, that's fair enough.
So yeah, I do that as well. But that was my, I have to be productive in the pandemic thing. That's what I did.
Sure.
And what did you do?
I mean, I went on universal credit.
Yeah?
Like, there was literally nothing else I could do, because like I said, for me, I don't know, maybe I missed something on these grants, but whenever I applied, I had to have 3 years of books to show, to be actually, for them to extrapolate what they think I should be getting out.
Really?
Yeah, even though I was previously employed PAYE, like, I didn't have any moment of unemployment, but because I only had that small amount of time in their eyes, and I literally could get nothing, unless, like I said, my advice was bad. But
I don't know, I thought it was just like graduated according to how many years you've done.
No, yeah, for me it was just a 3-year
To be honest, it wasn't
cut-off.
that helpful for us. I know it was really helpful for others.
Sure.
I did know of like people who were abusing it as well. Like, some people were claiming it even though they were still working in the NHS.
Yeah, I know.
And getting their NHS pay. And I was like, shit me, your NHS pay is crazy. I left the NHS. Like I left the NHS when COVID hit, because at the time they wanted us to continue working in clinic at really low pay. At like crazy low pay. It wouldn't be worth the risk. I had my parents staying with me and everything.
And what, that they enforced that when COVID came about?
So it was, some people had really great deals. It really depended on your boss at the time.
Okay.
But my principal he was doing something a little bit funny. Like, he owned a few practices, so he was withdrawing from a few different places. But yeah.
So the pot that should have been used for you.
Well, it wasn't, because like he was working, and I know he has lots of overheads, and it's not like he was forcing me to work. It's like, are you happy to work at this rate? And I was just like, to be honest, no, because we didn't really know what COVID was then either. So like, I do have colleagues who were happy to, because they said, oh, we'll increase it later. I just thought, you know what, if I caught it now and I gave it to my parents, I'm like, look, I've got a bit of savings, I'll live off that. But some individuals, like, forget principals and stuff, like some individuals were just like making a crazy killing at the time, not doing a lot of physical work. Some people were really suffering.
Yeah, I knew some people that were taking the grants in and then they were still working for the company, just like in cash, like backhanders. Kind of bit them in the bum really, because they spent all the money, like they didn't realise that was actually tax deductible.
Oh.
So they went out and bought new cars, put deposits down on things,
Oh,
and
crap.
yeah, they ended up with some huge tax bills because they ended up having to declare everything.
Yeah, and there was nothing tax deductible.
Yeah,
in that.
and it was all just
fun stuff.
They weren't meant to be working, so what expenses have you got going out for the business? And no, I just use lockdown as a time to get in shape. Really, I was just going on runs every day.
Oh, that's really good.
I just saw it as like the last 6 weeks holiday I'm probably going to have.
Do you know what? I really did enjoy it in the beginning. I actually was like, I love this involuntary holiday. I was actually watching like Netflix in the daytime.
Bloody hell.
Yeah, that was like, whoa, that was mad. I hadn't done that for a while. But like my other half was working throughout it, but from home.
Really?
Yeah, so it wasn't any different for him. It was just a bit crapper, really.
Yeah, it was interesting seeing the people that did work home, and I was one of them at one point because I changed careers during COVID.
What were you doing before? Oh, you told me.
So I did air conditioning.
Yeah,
and then
so rad.
Yeah, no. So I was an air conditioning apprentice, and then I changed and was a trainee project manager for the people that were hiring the old company that I worked for. And so sometimes I could work at home where it was doing like takeoffs for, like a takeoff is just count and say like, we need this many toilets because there are this many toilets on the schematics. Okay. That sort of stuff. So I could do that sort of stuff at home. But it was interesting to start to see my home life being encroached with work.
Okay.
From things that, from people that really had no business in getting involved with me during that time. So for instance, a lunch break at home, it was almost like sacred. Frowned upon because it's not like they're there to see you taking that lunch break. So that it was like an assumption that they're just skiving off all day. Yeah.
It's so rude. Like the ownership of your personal time is gone just because you're at home.
And I felt bad because it's like,
I could be doing something.
Well, I felt bad because I don't know whether it was I was just so used to working for someone, but I almost felt that, I don't want them to think that I'm skiving off, so I better be doing this, better be doing that. And it was just, it became more and more really, and that carried over into when I started doing this because I'm not doing an ordinary job, but I was trying to fit it in an ordinary sort of schedule.
9 to 5, yeah.
Yeah,
Monday
and so
to Friday.
Say if I laid in a bit one day, I'd feel really bad for doing that, but then I don't take into account that I've made those hours up and more in the evening where you couldn't normally do that in a normal job. It's just
a different format for productivity. Like,
it is, yeah.
It's completely different, especially in what you do, because yours is so like events based. And
yeah, it's what's happening, then you plan around what's happening basically for what I do.
I think it's more, you have to make the goal, and like whether it takes you 2 hours or like 10 minutes to get the goal, as long as you are achieving the things you need to at a certain rate and you're not loafing and just not moving on to the next point, it's fine. Yeah,
as long as there is some progress.
Yeah, exactly.
Yeah, I think for me, I do get too focused on how quick the progress is being made. I don't know if you've ever had that in your life.
I'm very impatient, super impatient. And when I have an idea, I want it to happen now. I hate when it relies on other people, and I hate when it relies on administrative systems and bureaucratic stuff. Like I've just like submitted a paper to be published. And I'm like, when are they going to reply? They've got my email. I'm like, obviously they're doing a million other things, but I'm like, but I've submitted it. So I've done my bit. So now you're just waiting. Yeah. So it's laborious when you're ambitious.
Do you ever find in any aspects of your work, like comparing the dentistry side to the cosmetic side, would you class it as cosmetic? What is it?
Yeah, cosmetic. We call it aesthetic. Same thing.
So do you find that impatient feeling is sort of combated from either work sides that you do? Do you understand what I'm asking? So, for instance, I was a very impatient person in everything I was doing prior to this, but since I've started this, it's helped me realise that, or
slow and steady sometimes.
Slow and steady, but I think it encompasses the fact that I actually enjoy the process instead of I hate the process, but I want to get to that position. For me, I felt that's where a lot of my impatience came from.
Well, for me, particularly, especially when I'm working on like a big cosmetic case or something on someone who has like existing dental disease, does not happen overnight. There are so many factors. Like, you're limited by biology as well. You're limited by how quickly a body can heal. So yes, it's frustrating because I'm like, I have a vision. I know exactly what it's going to look like. And I know that patient is desperate to get to that point as well. But I'm like, look, you've spent a lifetime like this. What is the harm if we have to wait 9 months for this whole process to finish? And a smile can take 2 years, depending on where you're starting. Like, I have a patient who I'm just working on, such a lovely person, came in, he's lost like 100 pounds of weight, has some really random, interesting job. I don't even know what it is. I won't say it just in case. I don't understand it. But he's working for a new American company, and now he is really conscious that if he has to go to the States, that they're going to be very judgy about the state of his teeth. And he has like decay throughout his mouth. His teeth don't touch at all at the front. Like, when he bites, there's like a big hole of black space between his upper and lower teeth. And so that's a skeletal problem, teamed with decay, teamed with like years of bad habits of drinking acidic things. So it's a big plan, and it involves surgery. It involves him cleaning properly. And like, if he's not, each stage of treatment gets delayed. I'm like, until you can clean properly, I can't work on you.
Right.
So it's like, it takes 3 months for the body to heal after cleaning really well. And then you slip again, and then your oral hygiene dips again. And it's like, no, can't go ahead now. So yes, it's frustrating, but it has taught me that you can enjoy the process. It's helped me to motivate people to collaborate and actually cooperate with me. So that's a nice thing.
Do you have that with a lot of patients?
It can be tough because a lot of people are coming with like a lifetime of bad habits.
Yeah, because to me, the way that our world works sort of creates the habits that really go against what you're trying to do there, because like people think as soon as they pay that money, they get what they've paid for.
Smile.
Yeah, and so when onus has to go back onto them, even after they've parted with some money, I mean... Especially
because in this country, like, we pay for dentistry, we don't pay for healthcare, generally, unless you do private. So there is a very different attitude that I've paid now, and they're paying a significant amount of money. Even, like, I work in a private practice, like, just like one white filling is like about 180, 200 pounds. And if you have neglected your mouth and you need like 6 fillings, that's a lot of money to part with for something that doesn't even really give you pleasure. It's just to get you healthy.
Sure.
So then the attitude is that, like, I've given you like £1,000. Oh my God, you're rolling in it as well. It's like, I'm putting in hours of work, absolutely hours, to get this sorted. And what they don't see is the cost of their healthcare behind the scenes. So you walk in a hospital, you're paying crap loads. Did you see that, like, that TikTok or something where someone asked people what they thought it cost to have a baby?
No, I didn't. No.
Oh, there was
what, for the hospital to deliver a baby?
Yeah, and it was like £20,000
really?
or something. And I was like, I think there was like a US version where it's like $20,000 for $20,000 for like a natural birth. If you want drugs or if you want a C-section, it was like $100,000 or something. I was like, what the fuck?
In the States, does the individual get charged for that?
If you don't have insurance, you just get a bill.
That's insane.
Which is why insurance is such a big thing there.
Yeah, that's crazy. That's crazy. I think we've kind of gone a bit off topic to how you got to where you are now.
Is that what this is about?
I mean, I'd like to vaguely try and stick towards that, because I feel like just from my personal experience and the people that I've been around, there are a lot of people that think that they want to start something, but they've built up all these barriers over the years into why they can't, and in reality the barriers aren't actually there, it's just they put them there themselves.
There's a lot of that. Like, most of us put ourselves boundaries, like, oh, I have to do this by 30. That is a really common thing, right? Like, I'm too old to go back to uni, I'm too old to make a career change. That's a very real thing, and most of us, we're imposing that, and it's like, why are we putting that there? We have ideas of what we should have achieved by a certain point, but if it's not suiting you, if it's not working for you, what's the point in going 15, 20 more years into that and like hating your life even more? Better to change and be like, oh well, I did it a bit late, but I did it.
The one big issue I found through just trial and error was setting unrealistic targets, because that comes a lot like with the impatience that we just spoke about, where I'd be setting targets that were way beyond my means for the time period I've given, and then
I will be a millionaire.
Or like this manager above me, I want to take their position in however long, and I never stayed to see if that was feasible, but for the period of time between that end date that I wanted to achieve this by, the closer I got to the end date, while realising I'm nowhere near that, was again like a barrier that I put up. Like, this time it hasn't worked, well, what's to say it's going to work next time? Or another example would be, say I get like a quote through or I get an inquiry through for a big job, say a job that I've never sort of filmed something on this scale before. Yeah. And there's like a crossroad that I come to where I can either say, nah, that's beyond me at this point, and then I'm done there, or I can actually go along and take that road. Every time that I say, no, that's beyond me, then there's like a barrier that I've put up where if I come across a job like that again, that's a barrier that I need to get over. Yeah. And this might be a bad way to look at things, because again, in certain industries, reputation means a lot. But now moving forward, I just try and say yes to everything, even if I feel like it's beyond me, because during that period of time, I'd rather figure out on how to get it within my means rather than deal with that barrier that I've put up later on by not doing it.
I mean, that's not a bad way to go. It depends on what's at risk, I guess.
Yes, yeah.
So like, obviously, if I'm not gonna say like, yeah, fuck it, oh, go remove something up in your sinus. No, I'm not gonna do that. Yeah. But they say like, as long as you're working towards something, you should work close, just beyond your comfort zone, basically, so that your comfort zone keeps moving further and further and further up, basically. So to stay a safe practitioner, like I do some like avant-garde, interesting things in dentistry. Like, I'm quite creative. I like problem solving, and sometimes conventional things just don't yield results. That is something that's good about private dentistry, though, is that I do have the flexibility to do whatever I want, as long as I have that conversation with my patients and I'm like, look, I haven't done this before. I don't know what's going to happen. I don't know if it will last. I don't know. But the worst case is this. The best case is that. Are you game? Do you want to try it with me? Yeah. And like 9 times out of 10, they'll say yes. Actually, 10 times out of 10, they'll say yes, because they're usually at the point where there's no other option. And then sometimes you find things that actually like, crap, I'm good at that. That was a good little finding. But yeah, not to be negligent. But yeah, I think at the same time, some barriers are useful. Because if you are, say you're doing something for 20 years and you keep trying and it's like hitting your head against a brick wall, sometimes you have to say, okay, cut your losses. Yeah. Like, okay, I'll set myself some kind of boundary as well and move on to something else. Sure. I don't think that that's like failing, and I don't think that that's a bad thing. I think that's recognizing, okay, do something that works for me.
Yeah, definitely. If you get to that extreme point where you have tried it 100 times, maybe you need to look at yourself.
Yeah, so some barriers are helpful, but some barriers are hindrance.
Sure.
Yeah, for sure.
Have you faced any of those barriers?
Hard to say. Well, I guess when I was going into dentistry, so I'm from a Pakistani background, like, it's quite, well, we're all expected to become like doctors, dentists, lawyers, engineers. And when I got to, was it 22, I was finishing my master's. At that point, people say, okay, enough now, get married to someone, find someone to marry, and then have your kids by like 27, and then you're done. And I'm like, crap, if I actually choose to do further education, I'll be 27, 28, like when I'm graduating. So I think I was turning 27 the year I graduated. And when you're like 21 or something and you think about yourself at 27, you're like, shit, that's so far. I'm so freaking old at that point. I should have had this, that, and that by then. Now looking back, in my early 30s, I'm like, oh my God, I'm so glad I did not give myself that limitation and think, oh no, I have to settle down in this period. I have to have kids by this point. Because I realise how young that is now. Like, and so I went for it, and my parents were supportive because it was something worth it. So yeah, I have come up against it in that way. I did really think about it. Like, should I not just go and get a job and start living my life? Like, how long can I be a burden? Okay. And I wouldn't have done it if I didn't get onto the accelerated version of dentistry, because the NHS gave me a bursary for part of it. They paid like a third of my tuition, and I could not have afforded it otherwise. There's no way. If I was paying like £9,000 a year and then paying for my living and everything, no way.
Sure.
In like central London, no way. Wouldn't have happened.
Was the expectations of your family a hard thing to deal with?
Yes and no. I think it was a driving factor. It made me very ambitious. Yeah, I think that was a really positive thing. But yeah, there's obviously like first generations of immigrants. Like, your dad's not first gen, is he? He's second, isn't he?
Yeah. What's first gen actually coming here?
Yeah, like they came here within their own life.
Yeah, no, he's second generation.
Okay, because like, so they've been brought up here. They kind of understand the culture and everything. But for them, they came here in the 80s. Well, my dad was here like early 80s. My dad was basically a cricketer in the beginning, and used to play for Pakistan and stuff like back in the day, but it wasn't very lucrative. And so that's my dad's expectations. His dad made him get a real qualification, so he became an accountant. Okay. And he trained to be an accountant in London, and so that's when he was here. But they are so far removed from what they've grown up around, and also so desperate for you to not lose your culture, religion, all of these things. So they are strict, and like they're scared of the other. So that was like, I wasn't allowed to go out like my friends were. I wasn't allowed to sleep over at people's houses, like all these things. It was very fearful. But slowly, after years and years and years, they've opened and opened and opened up. But it was tough when you're like a teenager and you're like, Mum, you don't understand, I want to go out in Shoreditch, blah, blah, blah.
So when you said fearful there, did you mean your parents were fearful of the outcome for you?
Yeah. So if I didn't do what they thought was the formulaic way to be successful, like do medicine, get a husband by 23, have kids before 30, they were very fearful about like what happens. But actually turns out all of us second gens, I'm like one of the only ones in like my age group who even are married actually. Right. And like no one is doing what their parents wanted them to do, and they all come from like families of Pakistani doctors. And they're really high achieving, but they've done things their own way largely. So they're all quite independent and living their life. Yeah,
it's like that sort of phenomena is like when you realise everything you've been taught and everything you should be scared of isn't actually the case. Yeah. So it's like, well, what else can I explore that actually has a benefit to me?
I think as long as you approach things with like productive and good intentions, you're not pursuing things that you know when you're pursuing something that isn't right for you. You know it. You can lie to yourself, but you do know it. Yeah, sure. So as long as you're approaching it from the right perspective, like I want to be successful in, I don't know, well, there's all this ridiculous, like all sorts of things now. Like there's like crypto, NFTs, Forex, I don't know. All this stuff I don't understand.
No, exactly. And
we were discussing NFTs, weren't we? And we were like...
Yeah, it's pretty crazy.
You understand it more than me.
Well, I still wouldn't even say... Like, I can tell you what someone else told me. I
understood that concept. I get it. What, like the modern day country club almost?
Yeah, so that was... I was talking about... if you're... Like, people that have like that Bored Ape... NFT is an example of that. Like if you see someone with a Bored Ape NFT, you know that they've either got X amount of money or they're
their network.
Yeah, right? that's someone that probably does have value to you, because to get that in the first place, they need to have some value behind them.
Exactly.
But that's just like a really vague explanation of just one thing. Yeah. Like the other explanation is, it's just like people that used to like collect Pokemon cards when they were younger.
I was talking about Pokemon cards the other day. I was like, I can't believe, God knows, I think we gave them to Oxfam. I had a shiny Mewtwo. I had all sorts of stuff, and I got that one from New York.
You could have been walking around with it like on a chain.
I would have had it in Diamantes, and it would have been spinning, a little Jigglypuff. Like,
nice. Oh, those cards are actually insane. Like, have you know Logan Paul?
Yeah.
Yeah, have you seen that he wears it around his neck? But that's actually worth more than probably any rapper's bit of jewellery that they're wearing right now.
It's actually insane.
Yeah, and
the Paul brothers are just mad.
have you heard of Gary Vee?
No, who's Gary Vee?
Gary Vee's this guy he's like on just like a social media guy that is really into his marketing.
Okay.
And he's got, I was about to try and do his voice. He's got a really distinct voice. It's like,
Please.
Oh no.
I invite you to try.
I
won't know if it's good or bad.
No, you won't. I'm trying to think of what to say. He's like, so guys, you've got to do this. You got like, if he see a meme that goes around is when someone tells him his age, because their age. Sorry, his big thing is like telling people how much time they have. So he'll say to someone in the crowd like, "How old are you?" And they'll say, "Oh, like 28." Oh my god, bro, you've got so much time. So go on, like that's his type of thing, and he's very enthusiastic and he's very successful. To be fair.
Okay.
And he gets involved with all sorts of shit. Like he goes to garage sales and will just buy stuff. Even though he's a millionaire, he'll just try and make a profit on anything. Okay. And he had one of these rare Pokemon cards that was graded, so it's in like this plastic or metal box. Like it's been given a grade.
Probably mine.
Or it might be the Oxfam Mewtwo.
Yeah.
And Logan Paul bought that off him.
Okay.
But then he was like, I think this could be graded to one better. So like the card he bought, I think it was like a Charizard or something, and there was like 3 of those in the world. And he was like, I'm going to cut this box open and send it off again to be graded, hoping that it would be graded higher. It could be graded lower, and then he's lost a load of money.
Yeah.
And he sent it off. And it got graded to the next thing, and he just made like a couple million just off of cutting it out and sending it back off.
I don't understand.
But it's like the way money's moving around nowadays, it's...
But like, what actually is the value to it?
Well, yeah, it's... If no one likes Pokemon anymore, then there's no value, or it's just... I don't know.
We were discussing, we're like, what is the value to a £5 note? Like... It's all just tokens for something that doesn't actually exist anywhere.
Yeah, exactly.
As long as someone's interested in it, it matters.
That's why it seems like the government hates crypto so much, because they're
decentralizing.
They're reinventing what they already invented and giving people the reason or the knowledge to why what they invented was a bad thing. It's, I don't know. And now they're trying to make their own cryptos, but all centralized. It's all a mess. We veered off again.
Yeah, well, yeah. Oh yeah, what was it? How did I get to where I...
Here's a question for you.
Okay.
The culture you've grown up in, is there like are there stigmas around your culture that have affected you in your work life?
I don't think so. For me, I think it might have only helped. But to be honest, particularly like I must say, when I went to do dentistry, I was like, crap, it's like all brown. I was like really shocked because it's like the biggest dental school in Europe, and I was like, all of it, like I would say like 70% of the year was probably some form of like Southeast Asian. I was like, wow, like to the point where at graduation, so my surname's Sadiq. Oh my God, there was such a long wait for the Patels. There were so many Patels graduating. I was like, oh my God, I have no gauge of when I'm on next. Like, so I don't think it really held me back in this at all. And so I had a really fun master's tutor when I was in Queen Mary's. This very zany, wacky guy. He's like a kind of citizen of the world, didn't really live anywhere.
Sure.
But he was kind of everywhere.
Yeah.
But he was like, Sana, man, you've got to go and do your PhD in physics. And I was like, why? He goes, it's the time for the brown girl. It's the time for the brown girl. And I was like, what? And that was back in like 2012.
Right.
And do you know what? I think he wasn't wrong. Like, I think like there are a lot of doors being opened, like in a kind of positive way.
What's your opinion on those doors being opened for reasons that...
I just believe in meritocracy.
Okay. Can you explain that for me?
If you're good at something, you get it.
Sure.
That's it.
So,
and, yeah.
Would you agree with equality of opportunity versus equality of outcome then?
Yeah. Opportunity. Like, no one should be denied any opportunity for any reason at all. Like, if you can do the job, that's it. It's a weird one to do equality of outcome then. I don't know, maybe in certain industries it works, but I wouldn't be happy if I had a heart surgeon working on my child who I thought just got there because they needed to have like
an extra woman or an extra person of this ethnicity.
Yeah, I just want them to be good at what they do, and regardless, like that you should not be held back as a result of any of your identities. So
Sure.
yeah.
Yeah, it's more and more that seems to be a topic that I've seen discussed a lot. And when it's broken down to equality of outcome versus equality of opportunity, it's like where the argument breaks down, because it seems to be involved in a lot of like the social justice movement, where it's like everyone needs to be treated equally, which I'm totally for.
Yeah, everyone should have like the same human rights. Yeah.
But then, if X is doing less than Y and they still want to be treated the same, or if X is going around shouting hateful stuff but then wants everyone to believe what they talk about, where Y is respectfully like listening to everyone but not agreeing with them, and then expressing their views but then being frowned upon.
Tricky thing, because like in healthcare, I would never treat any of my patients I would never treat any of my patients differently because of, say, their lifestyle choices. Like some people, like I said, like some people cause a lot of harm to themselves. I'm not going to put them like lower down on a list to treat.
Well, that's interesting then.
Yeah.
So with your patients, if you have, say the individual you just told us about, where he keeps coming back and he's not keeping up with the hygiene, versus someone that they've had the track record with the procedures you've done already. They've stuck to everything. They've stayed on top of the cleaning, that sort of stuff. If those two individuals came in at the same time, they didn't know about each other. There's like a screen, two of you talking to them. Would you say yes to the person that has been following what you've given them more? Would you give them priority over the next?
Absolutely not.
You wouldn't?
No, absolutely not. The only thing that you prioritise is emergencies.
Okay.
So regardless of what the background is, whether that person has never brushed their teeth or not, if they have a huge abscess in their face, which can go to their brain, I'm not going to deny them because say, well, what did I tell you last month? I said floss every night. Yeah. No, I'm not going to.
So that comes back to the ethics side of things.
It's like if you have people with cancers, which are like lung cancers caused by smoking, are you not going to treat it because another person got it working in a mine? Like, no. Yeah. It will be on the urgency of the problem. It's a rabbit hole you can go down though. Like you can tip the whole world system on its head going down this. But
yeah, I've seen a lot of these same questions given where it's like someone that is in a coma and it's like where does the consent lie into whether they want to either just be taken off life support or be like drip fed forever or whatever. It's like if the individual has said to someone close, like, if I ever get in this state, I don't just shut me off. But then you've got like, okay, so for instance, say the husband has been in a car crash and it's in a medically induced like coma on life support. He's told his wife that, look, or his girlfriend, not wife yet, because when it's wife, that's when it comes, they get the responsibility.
Lasting power of attorney.
If he's consistently told his girlfriend, look, if I ever get to this state, just switch me off. But then the parents still have the overriding consent and they just want their son to be alive.
This goes to court all the time.
It goes to court, does it?
Yeah, it goes to court. If there's such a huge conflict sometimes, it can be really difficult. But it depends, who gets the lasting power of attorney inherited in the situation you're incapacitated or don't have mental capacity. So complicated.
It is a complicated one.
That's why it ain't a bad thing to write your own will when you're young.
Yeah, that's quite a morbid thing, but it's very true, isn't it?
Absolutely.
Have you written a will?
I don't have a written will,
but
I have been. No, do you know what? So I'm involved in lots of will stuff because my parents had me when they were a bit older, and so they've always been really cautious about everything. And so, like, I remember, like, from like the age of 13, like, everyone's like, it's Easter holidays, and like, what are you doing? I'm like, oh, we have a will writer coming to the house. My parents are alive and well, just so you know. They're just extra. My parents are extra. They're very overly cautious.
It desensitized you from an early age.
Yeah, so like to the point, what did my dad say? So my parents are Muslim, so my dad was like, do you know what? Maybe we should buy our coffin now. And coffin is like, sounds like coffin. It's like the outfit you are buried in.
Okay.
And it's like, because you're not going to want to have to think about that then. And we were like, what? Calm down. He's just so practical, and it's actually a really sweet thought. But no, I'm all right. But I have not written it in so much words.
No, you know roughly what you're going to write down.
Yeah, and it can literally just be something written on a piece of paper as long as it's evidenceable that you wrote it.
Okay, cool. When you
why are we talking about wills?
Because you said about I said about someone in a coma, and then another rabbit hole.
Yeah.
when was the first time you realised that your artistic side could be satisfied by the work you're doing now?
Very quickly, like
Was it?
literally on the first training course I went to, the first time I injected someone's face, I was like, oh my God, that's beautiful. I was like, oh, I love this. And to be honest, I got quite frustrated with painting. I got quite moody when I was painting because it wasn't like quite how I wanted it. And because my whole mum's side are all artsy, my mum would come in and be like, Sana, I think you can make the water a little bit better if you. I was like, oh my God, don't critique my work. But then I realised I was much more in control and more able to get the results I wanted via injectables. So very quickly I realised I loved it. So yeah, and then it was like a love affair. And then it was just getting the anxiety down, because your first year, you're shitting yourself every time you do it. Yeah. It wasn't the same as dentistry, because I've you've done 5 years of training. I'm like, I'm drilling someone's bone. I'm getting something out of their head. I know my parameters. I know I can stitch it back together. It'll be fine. But the fear with fillers was that you could block a blood vessel and cause someone irreversible death of their tissue, cause them blindness. And I was like, fuck, like, you're doing it. And like the blood would be like draining out of my head. I'd have to like have a pint of water before treating someone because I'm going to sweat it all off. So it's like, it took me like a year, 2 years to just lose that anxiety. But after that, it was just so comfortable. I love it.
Is it like second nature to you now?
Yeah. Like I know I can do it in any situation. I know how to handle whatever happens. Because
when I watch you perform your procedures, I have those same thoughts that you probably had the first few years, but it's all just so like I said, second nature. I can imagine that provides comfort to the person sat in the chair as well, because the last thing they'd want is someone going, oh, should I like making little noises. No, you don't. That's what I'd do. I'd be like, oh.
No, you never make a noise. Never make a noise.
Yeah, that's probably the facial error.
What is it? The more nervous you are about something, or the more anxious, the more calm and collected you should behave. It's like you trick yourself into being... Then you start thinking rationally when you behave rationally.
Yeah, your body would lead your mind in that sense.
Absolutely.
Yeah,
I think
cool.
so.
One of the like weirdest things I saw you do was using those cannulas.
You looked almost pale, I swear to God.
Yeah, so it was like cannula, like, is that how they're like that long?
Depends, like there are different lengths. I was using probably a 50mm, so like 5cm, which is about like that big. Yeah,
and just watching you like slowly push that across someone's chin under their skin, and then seeing the end
poking up,
like poking out. Yeah.
But what's weirder is their reaction. Their reaction is weirder, because are they in pain? No, it's weird. Like they can talk to me and they're fine. They're like, is it in?
Yeah.
It's weird.
Where did that technique even come about?
Cannulas have been around for a while.
Used in aesthetics?
Well, yeah, used in aesthetics, but it's being used more and more and more, but it's a bit more of an advanced thing. Like, usually when you first train in aesthetics, you just learn to use a needle. You put it there, you point, it goes there. Cannulas are more complex, but we use them for lots of reasons. They're bendy, they're not sharp. Like, you can bounce them off a balloon, it doesn't pop the balloon. They're blunt-ended. That's why we like them. So it reduces trauma in the tissue. So if you're searing through something with something sharp, you're much more likely to get bruising, swelling, pain. But also you're less likely to get inside a blood vessel and deposit filler accidentally inside an artery or something and block it. So obviously, do you know what? If you want to pierce one, you can. If you want to put your elbow into it and really put some welly in, you can pierce anything. But largely, if you use a cannula delicately, you can avoid a lot of complications. And sometimes it's really nice for giving like lots of definition. You can just leave like long, nice lines of filler. I use it a lot in the jaw.
Watching you do it made me really sort of question like, what is the structure underneath the skin? Because I was watching you get to points where it's like that can't go any further. Then it's
resistance,
like, and then it just goes straight through. What is it? Is it like chambers in under your skin?
So your face has lots of different structures in it, which are separated by fascia, which is like connective tissue. Which, if you like your meat, if you like to eat your beef and stuff, like you find like sinewy bits you can't chew through, bits where the meat comes apart in different ways, like different lobes. We've got that we are meat after all. So we've got that as well. We've got different compartments holding different structures. Some of them not to cross. So like when I'm working around here, if you go too deep, you can end up inside some salivary glands. Yeah, we don't want to do that. I don't want filler in the salivary glands. God, you could cause like all sorts of problems. Then you have to ultrasounds and very odd procedures.
Is that like is there like a like a feedback you get when you
It's
know you're going
tactile
too far?
feedback.
Or?
There's your anatomical knowledge, which you know theoretically, or that you know practically if you've done courses on cadavers, so like on human dead people. But then there's also the tactile feedback, which you only get really from practice.
So have you worked on dead people?
Well, as a dentist or a medic, you have to work on dead people anyway. Yeah, that's one of the first things you do before you work on dead people. Then you work on each other. By the way,
What do you mean? What do you do to each other?
Yeah, we learn all our injections and sedation on each other. So I've been a guinea pig for so much stuff. I've been so many people's first nerve block injections and stuff.
What is that, filler as well? Or?
Not filler.
Okay.
Not filler. We get models in for
Right.
filler days. So your first filler is usually on a living human model, but under the supervision of an expert.
But you've been knocked out by your friends, like.
Yeah. Oh my god. So a lot of dentists are really needle phobic, actually.
Okay.
Yeah. Really weird. A lot of the ones I know, anyway. Don't know what's wrong with them. But I'm really not. I'm really chill about needles. I don't know why. But so I think was it third year or something that you start numbing people? I think it's third year of the degree. So I remember this boy. There's like this more complicated nerve block called the inferior dental nerve block, which knocks out the nerve to your lower jaw, half your tongue, half your lip and stuff. And this boy, he was trash talking my nerve before he did it. He's like, your nerve's going to get crushed. It's not going to know what hit it. And I was like, okay, Benjamin. Honestly, yeah, I didn't know what hit it. I was like numb for like 12 hours, something crazy.
Are those videos you see when people get their wisdom teeth out? Is that
It's
nerve?
not the same as that. That's
No.
like, I don't know what crazy sedation they do in America where people wake up and they think that they've like murdered people and stuff. I don't know what loopy drugs they use there, but no, we do get to use laughing gas on each other, which doesn't work on me, by the way.
No. What is laughing gas? Is that
Nitrous oxide.
nitrous
yeah.
oxide? Okay.
We get to use that, and you're like taught how to like bring someone calmly into a sedated thing. You have to like talk about a story. Be like, you're on a beach. You see, there's a boat in the distance.
So this is all stuff that I see in movies. And I think this
It's
must
real.
Just be,
It's
yeah,
real.
It's actually real.
We learn it in pediatrics, but it doesn't work on me. But other people, you're like watching them like slowly crack up.
So is that just to sort of get them in another head state? It's not actually
Anxiety. They don't get knocked out,
Right.
so they are conscious. They can respond. If they are in pain, they can tell you, but they're like way more chill. They are like this. Yeah, and some people you have to give like diazepam and stuff. Like some people are really anxious, understandably, about having a procedure on their head. That's fair. I think that's a fair reason to be anxious.
Is that the same stuff that the kids are using nowadays in balloons?
I think it is. But I don't know how pure theirs is.
Because I haven't seen that reaction to my mates whenever they wax on a balloon.
I don't know.
It's normally like, well, I don't know actually. They do laugh sometimes.
You're meant to just a little giggle, a little smile.
Everything apparently like vibrates.
You can feel tingly.
Yeah.
You can feel like your whole body's tingly in your extremities and stuff.
What else have you tried?
Nothing else.
No?
Nothing else crazy, no. But it doesn't even work. Like, I had a really bad pain in hospital. I had to go to hospital. I had some terrible abdominal pain. I, was crippled. And they gave me, oral morphine. And it literally, my pain was still strong. But what I did feel was the precise feeling of someone directly stroking my actual brain. It felt like someone had their fingers with, long nails, on my brain.
Did it feel nice?
Yeah, it was I can feel all my pain, but I don't give a shit.
Oh, really?
I was like, oh
best
god,
head
it's
scratch
still
ever,
going
yeah.
on, but this is too good. So
That's weird.
it was weird, but they needed a lot. So I don't know. Maybe it's because my background is Iranian technically, so maybe my Iranian ancestors were hitting the pipes hard. I don't know.
Big tolerances.
Yeah, maybe.
Yeah, that's pretty crazy.
I don't know, but otherwise, no. I'm a very good responder to ibuprofen.
Oh yeah.
Yeah, excellent responder to ibuprofen.
What about paracetamol?
Not so much. Not my fave. Not my fave. Works well for a tummy ache though. Nice for a tummy ache. Recommend.
So you're like a medical anomaly then when it comes to.
I'm sure there's more like me.
Yeah,
but
sure.
they say that people who are hypermobile also might have difficulty with numbing. And I'm apparently hypermobile. My osteopath told me. I'm quite Well, I always I used to snap my ligaments a lot in my fingers in school. I wasn't even playing the sport. I was I went to catch a ball. I was rounding them up because I forgot my uniform. And I went to catch it and just all my fingers just snapped backwards. And then it happened again the next year. all my
Was it
fingers are like
painful?
really, yeah, they were like all fat, and I had to go to hospital and like have them splinted and stuff. But all my fingers are like really bendy. They're all a bit like, they all do like stuff like that.
But then, what correlation does that have to?
I don't remember.
'Cause it's
I was
not
reading,
like-
I think it's a connective tissue thing, because like your connective tissue is flimsy and it has an impact on how you metabolize some anesthetics or something.
Oh, okay. So regardless if you had those injuries and like became
No, you
double
don't have to have the
jointed,
injuries.
right?
Like, no, it has to be like you were naturally.
Right. Okay.
And sometimes it's part of a bigger syndrome or something. But
Sure.
yeah. But yeah. But I just have really flexy hands.
Fair enough.
There we go.
Snapped your ligaments twice.
Yeah, it was really same. It was literally like almost separated by a few days. It was like the anniversary of the first time I did it, and then I snapped them again.
It's weird when stuff like that happens. It's like I've had that. I haven't snapped anything, but a year ago I said to myself that I want to have an idea of what avenue I want to pursue in video, and I just said that to myself, and then like 3 days to the year exact, like I realised, oh shit, like I'm pretty happy in
Your
where I want to travel. Yeah, it was a strange one.
Your internal rate was in keeping.
Yeah, it was one of those moments where I was like, that was a bit freaky.
There's always weird things like that though. Like, do you not find like, I was just saying, like I always randomly like see like the same time on the clock.
Yeah, like was it
weird
angel
things
numbers
like,
or what?
yeah, I don't know what the hell this all means.
Yeah.
But it's like, but is it like that you think on another level you're looking to find weird connections? You just don't know, do you?
Do you have any sort of like mystic beliefs, like that sort of side of things?
I don't know. I honestly don't know. I like to think I'm just very open-minded. I don't rule things out completely, because I think that's very presumptuous. Because like people are like, oh, that's not science or whatever. I'm like, you don't know. No science was science before it was science.
Yeah.
Like you have to have a study on something to then prove or disprove something. I don't know. And some of it I don't necessarily think is science. Like people were all talking about like The Secret and stuff like this, so like early 2000s, like putting out your positive vibes and then positive things come to you. I think I'm like, maybe people just want to be around people who are positive,
Yeah.
and are more likely to give you an opportunity if you're not like sucking the energy out of the room. Like simple things like that. I don't think necessarily having like a mystic alignment.
No. I
I
find
don't know.
whenever I think about stuff like that, like for instance, you just said people might just want to be around people that are positive.
Yeah.
I always try and at least draw it's like a reductionist sort of view to it. But then that helps me when I can't bring a reductionist view to it. It's like, oh, that is maybe
That's
something a bit
interesting.
special.
Yeah. I mean, I won't rule it out. I've
Like-
never had any weird experience.
Like the
myself.
idea of manifestation.
Well, again.
Because to me, that's just me thinking about it. And
But if I just sit on my sofa, like say if I just sat here and I'm like, I am manifesting, I am going to be the winner of Britain's Got Talent next
Yeah.
year. Like, but I don't do anything towards it.
yeah.
What is that? Like usually people who are manifesting are working towards something. But then people like, I don't know, manifest the lottery, I don't know. But then no, I
But then
don't know.
but that's the thing, because as soon as
Maybe it's
whatever
more
they've
luck.
manifested comes about,
Yeah.
it's sort of given, like manifestation is given the crown, like, oh, it's done it for me.
But how many other people are doing the same
But
thing?
yeah, that's what
how
I
many
mean.
people don't make
So
it?
are you actually just
You see it in the arts
you're
a lot,
creating
right?
a consequence. Look, you're making a consequence look like a manifestation. Whereas
Yeah.
in like an experiment, if 100 people manifested something and then one person got it, it wouldn't be seen
It's
as
not evidence that
conclusive
manifestation
results,
has
yeah.
this. Like me and Robin were talking about like how like a musician who makes it, it's like you just have to never give up on your dreams, man. You just have to keep going. Like how many people have never given up on their dreams and they're literally like sitting on their parents' sofa
yeah.
because they never comes true. Some people it works for, there's so many elements to success. Like some of it is being right place, right time, meeting the right person, getting the right opportunity. Even if you do have the skills, even if you're excellent for it, you might still not get all the opportunities that someone else would
Yeah.
get in the right room
Yeah.
at the right time.
Yeah, the way I've looked at the opportunity side of things is like I want to try and be around when the luck's going to present itself.
That's a tough one.
Yeah, that is the tough one. You can't plan that.
Well, you're
but
saying yes to everything in your own words, so
Well,
maybe that helps.
I try to. Like, obviously, there are times when I say no, and the no doesn't ever come easy. It's always a lot of thought goes into that no. More thought goes into a no than a yes for me.
Yeah,
Yeah.
yeah. It's quite easy to say. Well, if you're a yes type person, I'm a yes
Yeah.
type person. You're clearly a yes type person. So saying no is something I've really had to learn. Like, why am I saying no?
Yeah.
It has to be a very good reason.
Mm.
Because most opportunities are just that. They're an opportunity, so why not take it?
Yeah, and it's it's what you make of it as well. Because I've had plenty of opportunities that would have been negative if I would have carried on with them. But that initial opportunity is what I made of that experience made me realise, okay, that isn't what I should be doing. And sometimes, well, a lot of the time, that's actually more valuable than the good times that I have.
Absolutely.
Because like, I know that I don't need to be around that type of person, or maybe that's like a trait for people in that area of work, or
so maybe that doesn't suit me so much.
Yeah, like I've come to realise maybe club events, like not really for me. If I don't like being in a club without a camera, I don't know why I'd like it with a camera.
So much better with a camera.
Yeah, if anything, it's just even more like I don't want to be it because I've got this expensive bit of equipment that everyone.
So you're not a club guy, are
no,
you? You definitely don't seem to be.
No, I like going out every now and again, like
yeah.
But I'm not the type of person that needs to go out every weekend. Yeah,
like
no. When I do go out, I make sure I have fun.
Yeah.
But that's why it stays fun, because I only leave it every now and again.
Yeah, it's tiring, man. I don't know if I'm just getting older, but like.
No, I don't know whether it's that or for me, or I'm only 21, so I can't even be saying
when
that.
you told me you were 21, I was like, no freaking way. Don't give a 21 vibe.
No, I appreciate that.
In a good way. You don't. Not that 21 is bad. Like I think it's like I definitely gave a strong 21 vibe when I was 21. But each thing has its time, right? It's just as long as I'm not still giving that vibe.
Yeah, that's it gave me an interesting thought there, because since growing up, I've always been told that I seem older than I am. And when I reflect on those conversations I have with people, I almost wonder, am I missing out on something because I'm not acting the supposed age that I'm supposed to be acting?
Not if it's an act. Not if you'd have to act.
Okay. I
would say, because it's not your natural tendency. You're not trying to be older, and you're not like being bored, like, oh, have you done your tax return?
Yeah.
It's not like that.
Yeah.
It's just your interests are your interests.
Yeah.
If you don't like BS and like being fluffy, like I just think back like to the way I used to talk when I was like 17 and stuff. Was just like I was like just like a bit of like an indie-ish kind of scene, and like we were all. I hate to say it, I'm from like the MySpace gen. Okay, I'm from the MySpace gen, and like the whole concept for people on that scene was like to overcomplicate the way they speak beyond being useful. So you'd say things in the most floral way, and I was like, man, I sound like a dickhead talking aloud. I sound like freaking Captain Jack Sparrow most of the time. Like
I find myself falling into that trap.
Do you?
I feel like I don't know whether it's.
I think you're quite direct.
I try to be, because if I'm not, I will like waffle.
Meander.
I will just go in roundabouts around the point just to try and make it sound good. And I don't know whether that comes from growing up trying to be taken more seriously, because when you're like, as you're going from say the age of like 10 to where I am now, obviously your vocabulary expands.
Yeah.
But when I was 10, I still wanted to be taken as seriously as I do now.
Yeah.
So when I started off, I'd realise, well, what I'm saying, either what I want to say isn't interesting enough, or how I'm saying is not interesting enough.
Did your family take you seriously when you used to express things when you were little?
Yeah, I think they did, but I don't know where it came from. I don't know whether it was that initial sort of drive to, I don't know, try and just get to somewhere over there, if you know what I mean.
Yeah.
And I found, as I got older and maybe like learnt a new word at school or whatever, I try and put that in every sentence that I use.
I like that though.
And then it's almost like when I was like 18 or 19, I'd notice myself in like conversations, I'd be doing exactly what you just said, was forming these really convoluted statements, which...
But it's a dead giveaway, really.
It is a dead giveaway, because it's like...
You don't know how to use this.
Well, it's that, but then whenever someone's doing it, it's like, you don't even believe what you're saying yourself, because you're trying to make it sound better than how you think it,
it's
like
just
what it actually
it's
is.
flimsy, it has no direction.
No, and that's something that I always catch myself doing. Maybe I'll catch it before I actually do it now, but
I think it's almost like a thought process. Like I go through, it's like, why do we go on so many tangents? It's because it's like, when I start thinking about something, I start thinking about another thing, and so like you're literally speaking in real-time thought. You're not taking a moment to digest and say, no, actually, let me rein it in. I'm that person.
So do you speak in real-time thought? You don't take time?
I do. And I'm trying more and more not to. But at the same time, I want to say it's part of my charm. But as a healthcare practitioner, you do learn more and more to be considered in the way you speak.
Right.
Because otherwise, how is anyone going to follow you? Because you're trying to convey complex things to people. And in my head, I'm thinking, well, if I did it that way, I could do that. But actually, it could be all right if I did it that way. But you know what? The worst thing that could happen is I do it that. And I talk fast naturally. I have to slow it down. And by the time I slow down my speech, I have had time. I'm thinking ahead then. But when I'm just natural, like when I'm just chilling and like talking to people, I am talking real-time thought.
See, I'm the opposite.
Oh, really? Are you like considered and you're like...
I'm the opposite, but then it also has the opposite effect on me because the more I try not to think about what I'm about to say.
Okay.
Because when I do, that's when my head's like, oh, use this word as well as this word as well as this word.
Okay.
And if I end up really thinking about what I'm about to say, it ends up not coming out.
Oh, okay. So you get a bit stifled
A little
by the
bit,
pressure to create something good.
Like the masterpiece I think I'm about to create, it just never comes. And then I'd rather not say what I was about to say.
Oh, that's sad.
But so it's weird how it affects different... It's not really. It's not really.
I just never speak.
No, yeah. That was actually a big thing, to be fair, for
Really?
me when I was like 16, 17.
Were you just very quiet?
I was quiet because of the conversations I'd have with myself. You know what I mean? Like when
Okay.
you
You're
know
very
when
cerebral.
when you get home and maybe you think about something that happened during the day and like those thought processes I used to go to, it was like almost enough. I'd rather just not say anything and then I wouldn't have anything to think about. But
Okay.
I grew out of that, or didn't grow out of it, but used that to move forward with.
Okay.
And it was a big like portion of just not giving a fuck what people thought.
Well, that's good in a way.
Just like just being yourself, like all
Yeah.
sorts really. It wasn't like a be all and end all. Like I see it as a good thing that happened because I definitely wouldn't be the person I am without that. So
Well done.
thank you.
Very good.
Can you give everyone listening just one last bit of advice? And
All
that would-
three of you listening.
all three of us, yeah. And that would
Okay.
be on what would you say to someone that was in your position at the end of their A levels before you realised you were going to get this offer?
Okay, so it's hard to go back in hindsight because a lot of stuff happened fortuitously.
Right.
Okay. Before you get to A levels, figure out if you actually want to do A levels and if you actually even need A levels, because I think more and more university, I'm not sure is actually that useful for lots of things, unless there's a very specific thing like you want to go into medicine or dentistry and stuff. This isn't advice. This is just me thinking aloud.
This is good advice.
Okay, because I think a lot of people think they just have to go to university because you need it to get a job. Mate, everybody's got some kind of degree from somewhere. I don't really think it differentiates you that much anymore in the job market if it's for a job. If you really, truly, truly, truly are very interested in the topic, great, because then you're going to pursue it to the nth degree. And I think nowadays, if you're going to do something academic, you have to pursue it to the nth degree to stand out at all. Because there's a million people with like a finance degree who have not managed to work in finance, or with engineering degrees who have not managed to work in engineering, and they could have started the same work pathway at 16 and worked their way to the job that they get up to with no debt. Sorry. That was a big sentence.
That was a good sentence. And
Was
I
it a
think-
sentence? I don't know if it was.
And to be fair, you perfectly described my thought process
Okay, good.
deciding to go to uni or not.
I think that's the biggest thing. I think once you've decided that, okay, what I want to do requires a specific qualification or not, then you just have to go down it. But to be honest, like, who the hell knows what they want to do? Like, I could not have planned what I wanted to do. So if you really have no clue what you want to do, I would say either do a vocation.
Yeah.
I would say vocations are like the future because you can make like a business out of them so easy if you think you have a business aptitude. Or do something that keeps your options open. A science degree keeps your whole life quite open. At least you can go down finance, you can be a teacher, you can do whatever you want, and you can enter like medical or dental or whatever. So I'm like, that's a fail safe,
Yeah, sure.
I'd say. And I don't think it really matters which uni you go to as long as you get the degree. I think people get so hung up on what uni. No. I know like so many people in so many good positions who like just about managed to get the degree from like Teesside uni or something, and I'm like, sick.
You got it. So
That's it. It's a degree. It's a degree, isn't it?
nice. No, appreciate your advice today, Sana.
No, thank you for having me.
Thank you for coming down. I know it was a
you.
journey, but we've had some good little snippets in there
Sure
that
have.
hopefully can help some people.
Hope so.
Yeah, nice one. Cool. Have a good one, guys.
Bye bye.